Welcome to Health Talk. Heart disease is the #1 killer for men and women. It's extremely important to understand the disease and its risk factors, which include diabetes, high blood pressure, high blood cholesterol, overweight and obesity, physical inactivity, smoking, and nutrition. Today, Dr. Bill Harris, Pikeville Medical Center interventional cardiologist, will explain the concerns of tobacco use as it relates to heart disease, the risks surrounding polypharmacy or over-medication, and why it's important to take all your medications to every doctor visit. Now we join Dr. Bill Harris.
I'm Bill Harris. I'm an interventional cardiologist at the Pikeville Medical Center. I have the privilege today to talk to you about a couple of subjects that are extremely close to my heart and should be close to everyone else's heart health. First and foremost is smoking. I think way back in the 60s, maybe even in the 50s, they put on the package that cigarettes can kill you. But somehow or the other, people do not seem to read the package and take that to heart. It's interesting, the latest statistics in this country, about 21% of men smoke and about 17% of women smoke. About half of those people start smoking before age 18. And in general, they start at age 14 or 15. So one thing we need to learn from those statistics is we have to start education at an early age about how important it is not to develop the bad habit of smoking. For instance, women who smoke have 6 times the chance of having a heart attack compared to women that do not smoke. Men who smoke have 3 to 4 times the chance of having a heart attack compared to men that do not smoke. Smoking has been related definitely to heart attacks, stroke, lung cancer, throat cancer, tongue cancer, cheek cancer, COPD, and emphysema. Several of those are very miserable ways to end your life and affect the quality of life. There's absolutely nothing good about smoking. Another big issue in the last few years is secondhand smoke. We clearly now know that secondhand smoke can increase your risk of having a heart attack, can increase your risk of having a stroke, and it probably increases your risk of developing lung cancer. So there's been a lot of movements in towns, including the town of Pikeville, to ban smoking in a lot of public areas and residents. There's cities in the country who did a study looking at the number of heart attacks before the smoking ban and after the smoking ban, and clearly showed a reduction in the number of heart attacks. So secondhand smoke is detrimental, unhealthy, so it's no longer such a thing as saying, gosh, I should have my individual right to smoke next to someone and give them a heart attack or lung cancer. So overall, smoking is a terrible habit. It's a terrible addiction for people to overcome, and it's incredibly bad for your health in multiple different ways. One of the problems that the healthcare profession has had, we have not been very good at offering you ways to try to stop smoking. I think doctors in general do not spend enough time trying to educate people about ways that they can break this terrible addiction. We have a lot of substitutes that are nicotine substitutes, so at least you eliminate some of the stuff in the smoke and the tar, which all have bad effects. The nicotine substitutes nowadays come in patches, lozenges, gum, lollipops, and artificial cigarettes. It is not a bad way to try to wean yourself from the cigarettes over to whichever nicotine substitute that you decide to use. Eventually, though, it's an excellent idea if you can wean off the nicotine. We know that nicotine alone does have negative effects on your blood vessels and can lead to problems with atherosclerosis and hardening of the arteries. Another issue I hear is that, well, I don't smoke anymore, I use smokeless tobacco. Well, the data on smokeless tobacco related to all the bad diseases I mentioned earlier is not as strong, but there's every indication that there's still problems with smokeless tobacco. After I get them off cigarettes and smokeless tobacco, they come in and proudly announce to me that they're smoking cigars. Cigars are just as bad as cigarettes. So no form of tobacco use has any benefit to your health and should be immediately stopped. As parents, you need to start with your kids at an early age because, as I mentioned early, more than 50% start this habit around 14 to 15, and most are under the age of 18. Now, after I've told you all the bad things about cigarettes, why do you want to stop? Well, you want to stop because the benefits almost start immediately. Even for people who've smoked for years, after stopping cigarettes, particularly for more than 1 year, they begin to lower their risk considerably, and at some point in time can almost eliminate any additional risk from even several years of smoking before. We also know that if you have bypass surgery and you go back to smoking, the chances of having a heart attack or having to have some other type of bypass surgery or stent is much higher. We also know that if you have a stent and you go back to smoking, the chances that you're going to be back having me work on you for additional problems is much higher. We also know that if you have COPD and emphysema, you keep smoking, you'll be on home oxygen, potentially have to have major lung surgery, and die at a young age from a terrible disease. If you stop smoking, you reduce your chances. Even with bad lung disease, if you stop smoking, the progression of the disease can be leveled out and not continue to be a progressive, devastating disease. So there's proven benefit that stopping at any time, there's additional benefit long term at that point. One of the greatest stories to show you how important it is to never start, there was a marathon runner many, many years ago who had kind of gotten the health fit after living an unhealthy life, wrote books on running marathons, and he suddenly died of a heart attack once, and people were appalled. Well, unfortunately, prior to him deciding to get healthy, he'd smoked for about 30 years, 2 to 3 packs a day, was overweight, didn't exercise, had high blood pressure, and barely ever had his cholesterol checked. So the time to decide to live healthy is from the beginning. And I think it's important that we begin to teach this in the schools, and the Heart Association has been very effective at starting those programs. And as a parent, don't smoke, and encourage your kids to live a healthier lifestyle. I went to medical school at the University of Virginia. I was very nervous, 100 people in our class. I felt somewhat intimidated because I came from West Virginia to the University of Virginia, which was definitely appeared to be a more sophisticated place. And we walked in our first lecture. I sat in the back of the room, and a gentleman walked in with a bow tie and one of those sports coats that had elbow patches. And he got up, and first he wrote on the board that all medications are poisons. He underlined it, put the chalk down, and walked out. A lot of silence in the room for 5 or 10 minutes. And I decided at that time that I needed to go get a cup of coffee, and so we all left figuring, man, I can really memorize this lecture and I'll probably do well in school here. It's probably one of the things I've remembered the most from medical school, and maybe one of the most important things that as a patient you should remember, that all medications are poisons. They're designed to poison specific things. In the case of cardiology, maybe a blood thinner so that you don't get clots. It may not prevent clots on a valve or prevent you from having a stroke from atrial fibrillation or prevent your stents from clotting off. It's a specific poison for a specific problem. Every medication that you're given, the doctor has to weigh the benefits versus the risk. Every decision that's made is weighing the benefits versus the risk. Medicine is a science, so we should have good studies that tell us in certain patients that the benefit is greater than the risk. The more of these poisons that you mix together, the more difficult it is to determine the benefits and the risk. Multiple medications, or what we call polypharmacy, is a huge problem in this country. People tend to see multiple doctors in our current healthcare system. They get multiple prescriptions. It's confusing to the doctor at times. It's definitely confusing to the patient and the family. One of the most important things you can do for yourself is to greatly understand your medications, keep an updated list of your medications, And when you come to see your physician, bring your medications with you. It's very important for your doctor to know what you're taking. Now, this not only includes your prescription medications, this includes the stuff that you're conned into buying over the internet, at the drugstore, from your next door neighbor, and multiple other sources. Because these over-the-counter herbals and cures that you see on TV and the internet can be dangerous. A lot of these vitamins that we take and other things that people hear about, the assumption is made that they're safe. There is no testing of the majority of these things. There's no regulation of what the content of some of these medications that you buy. And there's absolutely no information of whether it's safe to interact with the medications that you're being prescribed by your physician. I do not recommend taking multiple over-the-counter medications, and you definitely need to tell your doctor about these medications. There's several drug-to-drug interactions with over-the-counter medications that can be life-threatening. St. John's wort was out several years ago and was used for a variety of things that it was rumored about. Some of the drug-to-drug interactions with that medication, particularly some of the heart medications, can be life-threatening. Another medication that people don't even think of it as a medicine anymore is a group of medicines that we call non-steroidal anti-inflammatory drugs, the arthritis medicines, the oh my goodness, I ache every morning when I get up medications. And there's many of these. There's Motrin, there's Aleve, ibuprofen's another name, there's prescription ones called Voltaren, Mobic, and there's a whole list of these medications. Trust me, they have multiple serious side effects. Very common side effect can be an ulcer, and you can develop this ulcer without having any of the typical symptoms that people think of with an ulcer. They can be detrimental to your kidneys. If you have kidney disease, they can be terrible for you. They actually have been shown to increase your chances of having a heart attack if you have known blockages in the arteries to your heart. They've also been known to interfere with other medications that you're taking for blood thinners and increase your risk of bleeding. If you have congestive heart failure, they can worsen your congestive heart failure. If you have high blood pressure, they can worsen your high blood pressure. Many times patients come in and never mention to us that they take 3 or 4 ibuprofen a day or 3 or 4 Aleve. These are serious medications with serious side effects and very serious interactions with a multitude of medications. One of my pet peeves my entire career is medications, too many medications. Nobody knows what they're taking. Nobody pays attention to the correct dose and the confusion that goes on. The problem is multifaceted though. The doctors are part of the problems. I think we tend to give too many medications and not pay as close attention as we should to all the drug-drug interactions. Patients, they don't keep up with their medications. They don't keep a list. They don't tell us what they're taking when they come to the office, which makes it impossible for us to make good decisions when we're dealing with multiple medications. I think sometimes we're just driven that if you go to the doctor and they don't do something to you or give you a pill, that it's a bad doctor. That might be the best doctor you've ever seen if they didn't do something to you or give you a pill. It is very, very dangerous taking this polypharmacy, multiple medications, over-the-counter medications. I can tell you, you'll do more for your health to understand your medications. Make sure your doctor understands your medications. And every time you see your doctor, ask him, which of these medications can I stop? And someone should always critically look at that list of medications and say, do they really need that medication? Do we have scientific information that the risk is greater than the benefit? Many, many times that's not true. The shorter the list of your medications, the safer it is. That's a simple fact, but a very difficult thing to achieve. We've become a pill society. We have a pill for everything. If you're sitting at home, you get a little heartburn, you might eat a cracker or take a Tums. Tell somebody in the hospital that you got heartburn, you'll end up on Prilosec and Carafate and Lord knows what, and then you may get sent home on it. And I think we have to be very careful about the multiple medications and the potential dangers of all these medications. So I plead with you every day we go through with this. Keep an accurate list with you all the time. In case something happens, you're out of town, you show up in an emergency room. When you come to see your doctor, bring them with you. I know it's a pain because it's a lot of them, but it's the only way for us to be absolutely sure to know what you're taking and how you're taking. Many times the prescription is written, take one of these twice a day, but then it gets modified 3 or 4 times by phone calls, and actually what's on the bottle is not correct. So it's important to bring the bottle, bring an updated list, and know how you're taking those medications. It's really important for your long-term health. I have found that probably 25 to 30% of the time, I look like I'm a good doctor, and all I'm doing is stopping some medications or reducing the dosage of medications. Try to take only what's absolutely necessary, that there is some kind of basis that the benefits outweigh the risk. One of the things that happens not infrequently, particularly if you do not bring your medications or you don't have an updated list, that you may see one doctor because you've got high blood pressure, and that doctor will make a reasonable choice of a medication for high blood pressure and give it to you. Then you go back and see either your primary care doctor or another specialist, kidney doctor, OB/GYN doctor, and your blood pressure is elevated. You didn't bring your pills. No one quite knows what you're taking, so they give you a prescription for it. And then you can go to the third doctor and have the same thing happen. And you may get 3 different prescriptions with 3 different names on the bottle. It's exactly the same medication. And we see this probably once, twice, 3 times a month when somebody shows up with significant side effects. And if they bring their bottles in and we could sit down and understand what they're taking, they may be taking 3 doses of exactly the same thing. One giant area where this can happen is when you're discharged from the hospital. It's very confusing. You come in and what they look at are the medications that you tell them on admission that you've been taking at home. They put that down. When you get ready to go home, there's a process called reconciliation. We try to reconcile what we're going to send you home on with what you were taking at home. Well, if we start out with misinformation to start with, the chances of a mistake are great. So it's very important to know up front what you're taking. The other place that there's a big mistake is that you need to clearly understand when you're discharged from a hospital, the medication list they give you at that time is all they want you to take. It has been reconciled with what we think you've been taking, and hopefully that's correct. So don't take the list they give you and then go back home and take a few bottles of the stuff that was home. I know that sounds ridiculous, but it happens very commonly, and you see a lot of problems and a lot of harm from that. It's a very confusing thing. I recommend that if you get put in the hospital and you're a little unclear about what you've been taking, that you get a family member or a neighbor or somebody as soon as possible to bring your medications to the hospital so that the nurses and doctors can sort out what you were taking before you came in. So at the end, when we reconcile these differences and come up with a final list of what we only want you to take from that point in time, that we do a better job because we understand what you were taking before you came in. Again, it's polypharmacy, different doctors in the hospital, in the ER. It's very easy to make mistakes if we don't know what you're taking, and if we're not very clear and very precise on what we want you to take when you leave the hospital. We're starting an initiative and a trial program at the hospital on the cardiac floor of different ways of doing the discharge teaching, and to look to see if we can do a better job of that and teaching people and understanding the medications when they go home, how to take them. That's the only medication. I think it's very important to have another family member there so that there's absolute clarity on that. And we need feedback on the way we do it, whether it works or not. Do you think we actually expressed it to you properly, or is there a better way that we can do it? Because it's very important for everybody to understand this. There's just so many problems associated with too many medications and the combination of too many medications.
Thank you for joining us for Health Talk. If you have questions regarding heart health, feel free to contact Pikeville Medical Center's Heart Institute at 218-2939.